we are looking at the neurotransmitters and the type of receptors. So this is our topic. So to start off with some questions. The first question is glutamate. So the glutamate, what type of receptor is this? What is the type of receptor? This is glutamate. Next question is acetylcholine. So what type of receptor is it? Third is the serotonin. What kind of receptor is the serotonin? So in this video, we'll find the answers to all these questions. And in the end of the video, we'll also have some bonus questions. So to start off with, we are firstly going to introduce the neurotransmitter and we're going to look at the receptor it involves. Now to start with the glutamate. So glutamate, the receptor, it is nothing but a ligand. It is a ligand gated ion channel. It is ligand gated ion channel kinate. There is also the NMDA and the AMPA. Next, there is also it is metabotropic, that is MGLUR. Next, we look at the GABA. So the GABA is nothing but it is a ligand gated. It is ligand gated. So this involves the GABA A and also the GABA C. Next, if you see, there is also the GPCR, which is nothing but the GABA B. Now moving on, we look at the acetylcholine. So if you look at the acetylcholine, here the receptor is nothing but there is muscarinic. So muscarinic, it includes the GPCR and there is also the nicotinic. So nicotinic, it includes the ligand. Then we move on to the norepinephrine. So what is a norepinephrine? So here it includes the GPCR. Then we move on to the serotonin. So serotonin, it again involves the GPCR. So there is an exception here. So that is nothing but except the 5-HT3. So this is nothing but a ligand gated, that is the 5-HT3. Lastly, we look at the dopamine. Dopamine is GPCR. This is the receptor. So now we are going to answer our questions. So what is the first question we asked? So the first question we asked was, what type of receptor is glutamate? So glutamate is nothing but firstly, there is ligand. There is ligand gated ion channel. There is a kinate, NMDA, as well as the EMPA. Next, there is metabotropic, which includes MGLUR. So this was about glutamate. The second question we asked was acetylcholine. So this acetylcholine, it includes, there is muscarinic. So muscarinic, it includes the GPCR and it is also nicotinic, that is ligand. Then we move on to answering our third question. The third question we asked was, what about the serotonin? So serotonin, the receptor is that it is GPCR and there is an exception except 5-HT3. 5-HT3. So if you see 5-HT3, it is nothing but ligand gated. This is ligand gated. 553 is ligand gated. So now we'll go on to our bonus section where we'll ask some questions. So you can answer these questions in the comments. So the bonus questions, the first one is, where is GABA? So what are the receptors involved with the GABA? The next question is, what are the receptors involved with the norepinephrine? What are the receptors involved in case of norepinephrine? Lastly, the third question is, what are the receptors involved in case of the dopamine? What are the receptors involved?